Just want to say thank you for taking the time to meet with me. My name is Tina, here with my daughter, Tiana, from Roxbury.
Okay.
Frederica, how long have you been in this position?
18 years.
Okay,
18
and
years.
how has it changed since you've been in this position?
Quite a bit.
Okay.
First of all, one of the biggest change is when I started in 2002, we were serving 5,000 people. This year, we serve close to 40,000 people. The most permanent change is in the first time in Whittier's history, we moved from a leased space to our own permanent space in 2012, which is a beacon of hope to the community. When you walk through the doors, it has that healing, welcoming environment. But the statement and the message we also wanted to convey to the community is Roxbury has great assets, Roxbury has wonderful people, and our patients deserve to have the best.
I agree with you. I couldn't agree with you more. And having these events like this are very important for the community. Absolutely. It shows that you care. Yeah. And so this type of event, this Christmas drive, you've been doing that for as long as?
Since my kids were young. Because the reason why the community, when you are a community-based organization, again, we have a lot of assets and strength. And those of us who grew up in communities and extended families know the importance. But the importance of community outreach and being embedded in the community, not just sitting in the community, meeting people where they are. We, for example, every year do 2,000 community needs assessments, and those drive how we develop programs. Those drive all of our public health programs, our prison reentry programs, our family nurturing programs, our men's health programs. Our community residents are telling us what they need. We know about the mortality, we know about the chronic diseases, we know about the morbidity rates, but our focus is around not just health equity, but also social justice, being their voice, being their advocate, and economic disparities. So providing resources such as this brings people together, celebrates who we are as an asset, but also says to the community, we care about your health and your well-being.
I'm sure this year it was a greater need, but do you have like a percentage that you would state as in previous years, maybe the need has been greater this year due to COVID and the many people not having their jobs? Would you say you've had to reach beyond limits?
Absolutely, yeah. One of the things that when you have been true to your mission and people know that they can count on you, they trust you, they respect you, you're reliable and accessible, I feel we have been preparing for this pandemic in all of what we've been doing, at least for the 18 years that I've been here, but also from the starting of our mission of our organization in 1933, where we are looking to close the gaps. The average life expectancy in Roxbury is 59.5 years. So when the pandemic broke, we knew it would negatively impact the Black and brown communities, especially Black people, because of the disadvantages we already have. And we've been working to close those disadvantages. And so one of the things we had to do very quickly is to set up COVID-19 testing. So our patients have a place that is reliable, that they trust, and will not only provide the testing, but also educate them and link them to care. When the state shut down during March and April to May, we remained open, not only to provide COVID testing, we were also providing telehealth services, but in-person care. We opened our food pantry. Prior to the pandemic, we only were serving people that were our patients in the pantry. But during the pandemic, when somebody presents and they're hungry, mostly seniors, sometimes people with children and families, we opened it up. So the need was great. We opened an emergency child care because now all of a sudden, our patients who were frontline workers who were not making enough became essential workers and had to go to work. And we had children that needed to be cared for. So we did whatever it took to meet the need but also to raise attention. I'm on the Mayor's Inequities Task Force for COVID-19, and it is my responsibility to, bring attention to what we knew would be the disparities, but also work with the city to bring resources to the community. So the need has been greater, but we've been training for this because we've remained true to our mission. We're seeing many more patients, but it was important that events like these, we are seeing significant increases in mental illness, substance abuse, chronic conditions, all kinds of issues. So for example, the team, we have a wonderful team at Whittier that believes in the mission. They are here every single day and they care for the patients. But we have children that are coming to the pediatrics clinic. Higher rates of suicide ideation, higher rates of depression. So a toy is not just a toy. Decorating and all of us getting into it is saying to the children, we care for you, you are loved. This too shall pass. It gives them a sense of hope for the future. And if you read some of the messages, they're very touching. They just want COVID to end so they can hug their grandmothers. But then there are children that are worried about the safety in their communities and want to be protected. So that's what this means.
It's a very good balance. And, thank you for having this event. Thank you for inviting us. Thank you for caring about your community.
Absolutely.
I myself have just started a nonprofit organization called Roxbury Good Girls, and it is to focus on the disparities in women's health.
Yes.
I myself, not to be too personal and take away from this event, but I myself had a late-term miscarriage.
Oh, dear.
And that in itself showed me that there was I wasn't being heard. My needs weren't being taken care of. So those and places like this we do need to be heard, listened to, and taken seriously. So thank you for everything that you do with the community here at Whittier and with this event. And I wish you luck, and I would like to definitely put this out and hopefully have more partners for you and other people that can.
And the work you're doing with women's health, we of course have all medical and social services programs. If you don't take care of the social issues, those things that make our minds and bodies strong so you don't have the late-term miscarriage, we have a program for women in the reproductive age to prepare them, because the maternal mortality for Black women and the infant mortality is so high. But we also have a program called Moms Do Care for patients that are struggling with the opioid addiction, so that we can strengthen them. Our community, again, as I said, this is an asset. We don't want to just be a neighbor. We want to be a good neighbor. We want to be a valuable neighbor. So we look forward to partnering with you, and best wishes and congratulations on your new nonprofit.
Thank you so very much.